clotting is a cascade. That requires multiple factors. This is part of your immune response. Clotting is a cascade. This is called agglutination. Just spell it here. I'm just going to let's slim it down to 3 letters. So, if I don't know someone's blood type, the only way I'm going to find out what it is, so I have someone's blood. I've drawn someone's blood. I have a drop of their blood. Blood type unknown. So I have this well. That's A, B, and RH. I have, if it's A, if their blood type is A, the only way I'm going to know that it's A is if they intentionally create an agglutination reaction. Does that make sense? I had to intentionally create a reaction to know what their blood type is. So I have to put anti-A in the well. I put anti-B in this well. And I put anti-RH in this well. I have to intentionally create that negative reaction so that I can know what their blood type is. So I don't know what this blood type is. Now I put a drop of this blood in all 3 of these wells. And now I'll wait and see what happens. So if this is what happens, what is that blood type?
A.
No. It didn't have a reaction. So whatever clots, that's what it is. If it has a reaction, if you have a reaction, if it has an agglutination reaction, that's your blood type. If you don't have a reaction, then that's not what your blood type is. You're intentionally creating an agglutination reaction. If you did this in real life, you would kill somebody. So you're typing and giving blood are 2 different things. So keep that separate. In this particular instance, we have no idea what their blood is. We're typing it. So now I know that their blood type is what?
B.
Right.
Positive?
Correct. It's B positive, because that's where the agglutination happened. If it agglutinates, that's what their blood is. Does that make more sense? No still?
So about so if the reaction wasn't in the RH, it would be negative?
Correct. So let's do this one. I put the blood in there, and that's what happens. What's that blood type? Correct. Oh, what?
Negative.
Correct. What's this blood type?
A negative?
A negative. Correct. What's this blood type? I don't know why I erased it. What's this blood type?
AB.
AB.
Positive?
Positive.
Correct. You seeing now? Okay, good. If you agglutinate, if you have clumping, that's what the blood has to be. And now I know that this patient is AB positive, and now I can go give them, if I have AB positive blood, I can safely give them any blood because they're the universal receiver. Make sense? And I'm going to still say, I'm not going to give them plasma. When I give them, I'm going to give them cells. And that's a good point. If I'm going to give them plasma, that changes what I give them. But I have to know what their blood type is. Does that help?
Yes, thank you.
Great. All right, perfect. Thank you for asking. Don't want you to be confused. I have the ability to make it make more sense. That's the RH thing. I think we've kind of covered that here too. We talked about this again. Do you want me to go over it again?
You can skim right through.
Okay, I'll do it again. So an RH positive father. So an RH positive father means you're going to agglutinate if I'm checking that. Most people are RH positive. It's a rhesus factor. We did this from, we found out we had this Rh positive factor in our blood. If you're an Rh positive dad and you're an Rh negative mom, if you get her pregnant, the first time, it's fine, but she's gonna make antibodies to that Rh factor. So the next time you make a baby, she's got these pre-made antibodies that's going to attack that baby, and it cause significant brain damage. So to prevent that, we're gonna give something called Rogaine. We give Rogaine. Rogaine prevents Rh factor problems like this. So if mom's Rh negative, that's why we do blood tests right off the bat. Mom's Rh negative, it doesn't even matter if she's first, second, third, we're gonna give her Rogaine before she delivers to prevent antibodies from damaging that baby. So that's what that's all about. So that's really, and so also during blood, like if we were giving, if you're Rh positive, it doesn't matter. You can get Rh negative. We're not gonna have a problem. It's only when it goes the other way. Rh negative people will build up antibodies. So we do care about Rh incompatibility during blood when we transfuse blood. So we will match Rh incompatibility, but it really matters. The time we really care about it is during pregnancy. It's definitely B. So understand that the antigens are on the cells themselves. Antibodies reside in the plasma. If you haven't written that down or if you don't fully understand that, you should make sure that you get that. Antibodies are in the plasma. All circulating antibodies to everything run around in our plasma. They run in our lymphatic system and they run in our plasma. This is your circulating warriors. When you go get that flu shot, when it becomes available, those antibodies that you create from getting that flu shot, they're gonna run around in your plasma. So when that person next to you in public coughs on you and they don't cover their cough, and they have the flu, before they actually start showing symptoms, your antibodies are gonna be already prepared to kill that virus before it even makes you sick, because that pre-circulating antibody is running around in your plasma.
O.
Definitely O. The only kind. It's the only kind that we can give is O. That's why if you go into, anybody ever given blood? If you are type O, they will call you and ask you to come give more.
I'll call you anyway.
Huh?
I'll call you anyway.
They will call.
Yep. Yep.
I've been getting texts like that the other day.
Emails.
They've been
It's the
calling.
emails.
Yeah, when it becomes a critical shortage, they will call. But this is the only, you can't get blood delivered from, if you live here, you can't get blood delivered from New York. Only the people that live around here create our own blood supply. So if people aren't giving blood, we run out of blood, and that's a real problem. So giving blood is really an important thing to do. So hemostasis. Everything about our body is about delivering oxygen to our tissues on time when we need it. So if we have a problem where suddenly we're losing blood, we have a bleed somewhere, clearly our body wants to stop that, and it wants to do it fast. So we have to be able to stop a bleed. That's called hemostasis. But do you want to clot too fast? What happens if you clot too fast? What do you think the problems are if you clot too fast?
The clots can go to your lungs and
You cut off blood supply to places, right? If you cut off blood supply to places, you lose appendages. People who have frostbite, you're out in the cold, your body appropriately vasoconstricts in the cold to keep you warm in the middle. But if you stay out in those extreme conditions too long, you cut off the blood supply too long, your tissue dies. right? So you see people who come in, their noses have actually started to necrose. Their fingers started to necrose. They will lose them. Without blood, tissue dies, right? So if you throw too many clots, you'll cut off blood supply to tissue, that tissue will die, period. But if it doesn't clot fast enough, what happens?
Hemorrhage.
Bleed out.
You bleed out. So it's gotta be just right. It's gotta be baby bear. Can't be mama bear, can't be papa bear, it's gotta be baby bear. So that process is very important. And it's not an easy complex, it's a cascade, and that's what I wrote over there. So the process of hemostasis, you need to write this down, you need to remember it, it's definitely important. Likely will be a question on an upcoming exam. So, the vessel gets damaged. You might be in the kitchen making yourself cooking up something great. Steak, vegetables, whatever. You slice your hand. The very first thing that happens in the middle of that bleed is you're gonna have a vasospasm. Your vessels are gonna vasospasm. That process in itself of those vessels spasming is gonna slow down the bleeding in that particular area. The second thing that happens is, once that happens, the injured endothelium of those cells send out a chemical signal to your platelets to tell your platelets to come to the injured area. Your platelets come, they start to plug that area up. People tend to help that. What do people do when you have a bleed, when you start to do to it?
Apply pressure.
You apply pressure. That helps. That helps the platelets do their job. So the platelets start coming along, they start to clot things off. Now, the platelets will do two things. They will send out another chemical signal to start that cascade, and they will tell your immune system, we've had a breach in our security. What's the biggest organ we have? Our skin. So once that breach is made, bacteria, which is all around us, we have actually more bacteria in our body than we have cells that are us. So once that breach has been made, it tells our immune system to go ahead and send some cleanup crew. We probably have some invaders.
Bless you.
Thank you.
And that's why bless you. That's why very often your wounds will be red and sore after you cut yourself. So now we start making a fibrin clot, and that is when we have fully repaired the damage. Now the tissue that is left, does it look the same as it did before we cut it?
No.
What does it look like now? A scar.
Yeah.
So the tissue is scarred. So it's not the same kind of tissue. Now it's a different kind of tissue. It's repaired, but it's not the same. It doesn't have the same pliability. Yeah.
Is it the same process on internal
Yes.
injuries also?
Yes. No matter where in the body there's a damage, if it's cut and there's bleeding, the same process happens internally as it does externally. So that's why when you have surgery, you can have adhesions internally. Adhesions are basically a scar, and it sticks together. Once you damage the original tissue, it will not heal the same. It will not work as the original tissue did, because it's become scar tissue. So, but eventually that fibrin clot needs to go away, and it eventually will erode. It will be cleaned up by mast cells. Those macrophages will come along and clean it up. And what you will have left there is that scar. It will be functional, but it won't be exactly the same as it was. It won't be able to vasoconstrict and vasodilate just as well. That's why people who give blood all the time, eventually those vessels become not as good. They have to switch to other vessels. People who do chemo, their vessels get horribly damaged by all the times that they have to give blood or get chemo. Their vessels get wrecked, and it's because they get destroyed by all the things that we do to them, and they have to go try. They have to get blood a different way.
Yeah, put a port in.
Huh?
Put a port in.
Yeah, that's exactly right. So this is your coagulation fibrin synthesis. I do not need you to memorize every single these are all factors. This is a factor 11, this is a factor 11A, this is a factor 9, this is a factor 9A. All these are different clotting factors. People who have hemophilia might have a clotting factor of missing, they might be missing factor 10, and that would cause a hemophilia. So there's different kinds, if you miss any of these factors, there's a von Willebrand's factor. If you're missing that, that would cause you to have a clotting disorder, and you may not clot fast enough and have exceptional bleeding. Women who are pregnant now, before they give birth, they check for clotting disorders. Why?
Because the hormones change
Because women die from hemorrhaging giving birth all the time. Massive amounts of bleeding can happen as you give birth. It's a very vascular area. That's actually the number one thing that is the thing that kills women after giving birth. They can't stop the bleeding. They have a rupture of placenta. The placenta comes out, it ruptures, pulls, and then there's just full-on bleed. You can't stop it, and they die from hypovolemic shock. And women still die from that in this country with all the medical stuff that we have with this. Women still die from that even in this country today. So they check for a clotting disorder prior to them giving birth, and they can give them medicine to help them clot prior to them giving birth. They may even do a cesarean section to prevent any issues prior. So you have two pathways. You have an intrinsic pathway and you have an extrinsic pathway. Either way, you're going to have some damaged surface. The whole point is getting down here to the final common pathway. In the final common pathway, this is what I want you to understand. You have prothrombin, which converts to thrombin. All of these things are conversions. Your body does this to prevent ill-advised clotting. I will tell you that inflammation will start this clotting cascade. You may have heard of people who have some bacterial infections that cause a showering of clots, and they lose their limbs. Have y'all seen this? Some people have infections where they got so sick that they had to cut off their feet and their hands because they were so septic that they had these showered of clots. Because your infectious and an inflammation cascade can set off a clotting cascade, and you can actually lose your extremities with that, because it gets into your small vessels and clots them off. But how this cascade works is prepared to prevent that. Those people are lucky to be alive. I mean, they lost their limbs because if they didn't do that, they wouldn't be here. So, but the thing that I want you to know is the intrinsic pathway and the extrinsic pathway will finally come together in the final common pathway. And in that pathway, prothrombin and thrombin will become fibrinogen, will convert fibrinogen to fibrin, and fibrin is the thing that will cause the fibrin is the thing that becomes the clot. We will check something called prothrombin time. How quickly do you convert prothrombin to thrombin? We will time that. If it takes a long time, are you clotting fast or slow? Correct. And so we give people who have had heart attacks, we intentionally give them anticoagulants. People call it blood thinners. We're preventing them from clotting on purpose. You have to be careful with those. So, that's a coagulation fibrin synthesis.
See?
Common pathway. Yes. So that's in the blood. What I want you to know mostly is that does platelets cause a clot? No, they're part of hemostasis. Hemostasis is what stops blood is what makes the clot. Fibrin actually really clots it off. Platelets help. So don't get caught up with that idea that platelets cause the clot. Platelets certainly help things stick. They don't cause the clot. So that is the last of everything that you will need to know for the test.
So just blood, vessels, and heart.
Blood, vessels, and heart. We will finish up everything that you need to know during lab this week, and then test is next week. I will open it up that you will be able to take the test in the testing center, That will be available to you. It is online. You can take it in the comfort of your home too, whichever works best for you. But that is everything that's on the first test.
So on
Just
our
wrap
lock,
it up.
if we want to use on our lock at home, does it have the option, because now you have to pay for it?
Honor lock?
Yes,
You do?
yes.
Really?
Yeah, you have to pay for, so you have the option, I think, to pay
Ooh.
for each, test, it's like $9, or you can pay for the whole course, which is like 20 something.
Oh, that's not too bad. I guess they sort of, I guess it's during COVID, they took that cost away. I guess they just put it back on.
Yeah, I don't know, and there was also something, about, like, they make you show your room.
Yes.
And technically that's not legal or something like that, so they had to like detach from schools and they made like private or something. I didn't really understand, but they're
Oh,
trying.
it's illegal to show your room?
Yeah, it's illegal like to make it, to like mandate the person to show like the 360 view,
Oh.
like, cause like it's private invasion or something.
Yeah, here's where I go back to, if you need to cheat to pass the test, you probably haven't learned anything and you're not doing yourself any favors. You know, now we have to worry about things like AI, like taking your test. I will tell you, integrity matters. Like, I never really got the whole, I mean, I started taking online tests too, and I think I started having to show my room too. I'm like, yep, there's my dog barking by the window. Like, let's get ready to go for the test. Like, you know, so it's like, it's just when integrity matters. And so you have to just be true to yourself. I'm not gonna be there watching you take the test. I'm just gonna assume that everybody's doing the right thing. If you give me a reason to doubt that, then I have to deal with it, and I don't wanna deal with it. Like, just everyone be a grown up.
How long is the test open for?
It's open for a full week.
Is it just, multiple choice or does it have essay questions?
Say it
Is
again.
it only multiple choice or does it have essay questions?
No, it's multiple choice and true false.
My last professor made me write
How many
like
questions?
stuff.
50.
It was annoying.
50?
50.
How long was the time to take?
60 minutes.
You know.
Like the TV show. Okay, next, let's get into it. Unless you have any more questions. So, lymphatics coming out after vessels makes a lot of sense, because lymphatics are a part of our vascular system. They're just a dead-end version. They actually follow very closely along with our venous system. Does anybody remember what I told you about? Does the venous side, when we did this, so you have the arteriole side, you have this side here that's neutral, you have this venual side. Does the venual side reabsorb all of the fluid?
No.
No, so it actually only absorbs, it reabsorbs about 85% of that fluid. So at least 15% that has to go back through security. So if you think about, it's like going to the airport where just for random reasons, they pull people out of the airport line and send you through security to go get patted down, x-rayed, take your shoes off, your belt off. They open up your luggage, take your bra out for everyone to see, put it back in, not the same way you packed it. Pretty rude.
They always choose me.
Huh?
They always choose me.
Yeah.
I know I don't have bras on my bed.
Well, I hope. I mean, you could, whatever, to each their own. I bet they're profiling you.
I look very.
You look like a terrorist.
Yes, I do.
Damn.
But clearly you're not. They're clearly profiling you.
9/11.
But they also pick pick out my mom, who's an 84-year-old Southern woman. I mean, so if that makes you feel any better, doesn't look like a terrorist at all. So, and you're very sweet. So, and she's actually meaner, way meaner than you are. I would actually be more concerned about her than you any day of the week. So they've taken this. So your blood kind of does the same thing. You've got this filtrate now. Instead of going through being reabsorbed through the veins, it now comes through this lymphatic system. And it's security. And it does that to make sure there's no infectious thing happening in your body. So it runs it through those lymphatics, where your B cells, your T cells, all your immune system is in there to make sure it gets cleansed. It's actually cleansing your body of any disease if it's there. If you have a cut on your foot and you're fighting an infection, would your lymph nodes, have you ever had your lymph nodes get involved and you feel your lymph nodes? What about your neck if you have a sinus infection?
Yeah, you can feel them swollen.
Yeah, and it's funny when you have that happen. It's like your hands just gravitate to it without even thinking about it, right? And you start playing around with it. You're like, "Oh, that hurts," but you still do it, right? Isn't that funny? You're like, "Oh, that hurts," but I'm gonna still do it. So I'm gonna tell you this. This is important. Likely gonna be a test question. If you ever feel a lymph node that doesn't hurt, you need to have that examined by a physician ASAP. A lymph node that does not cause you pain is not okay. It needs to be examined. But a lymph node that's activated is telling you something. It means your immune system has an invader and it's doing work. So when I got COVID for the first time during late 2020, I felt like a truck ran me over. I knew, this was before the vaccines were out, I knew that my body was doing work because every one of my lymph nodes in my neck, my cervical chain lit up. And it followed them all the way down. They kind of like handed it off. They were handing off a baton. One would light up, then the next one would light up. Then they lit up all the way down the chain. They went down here in the subclavicle region. They went all the way down. That's how bad the infection was. Because sometimes you have an infection and it just kind of stays right here on your neck and you fight it and you're good. COVID was so bad, every one of them were lighting up, right? So that's how you know that your body's really fighting an infection. So your lymph nodes are running from the bottom of your feet, the top of your head, all the way back to your heart. That's where your lymphatics drain back into it. Once the fluid gets into your lymphatic veins, it's now called lymph. It's no longer called plasma, which is what it is when it's in your veins. When it comes back into your veins, it's plasma, right? When it's in your lymphatics, it's called lymph, L-Y-M-P-H. So let's get into it. I'm sorry that happens to you, by the way.
No, it's fine. I just come extra prepared.
I know, but it sucks. Okay, we have a lot of lymphatics. A lot of lymphatics. And that's for a reason, right? We have to have all this protection. We were exposed to invaders every day. Every day. Right now, there's more bacteria and viruses in this room than we have cells in our body. Every day, you're exposed to things that can harm you. Actually, most of the bacteria in the world, most of the viruses in the world, are very harmless to us. There's only a small percentage that actually are pathogenic. Pathogenic means disease-causing. And everywhere you look, there's something that is disease that has bacteria and viruses. People didn't really know that there were viruses in the ocean water, but it turns out there's millions of viruses in ocean water. And now that the ocean water is warming up, that's definitely increased. So we have this massive, it almost looks like a mainframe of like vessels that are there to check out this fluid and make sure there's no infection in our bodies. And so we're gonna talk about all the different kinds of things that we have. We have nodes. Nodes contain a lot of our immune cells. We have ducts where fluid will come back to. Thoracic duct, these are main ducts, thoracic duct and right lymphatic ducts. We have axillary nodes. Sometimes women who have breast cancer, you see all the lymphatics that are in the breast. Breast cancer is, one of the reasons why breast cancer is so deadly is that cancer travels in what? In the lymphatics. So if breast cancer is not caught quickly enough, cancer gets out and starts traveling through the lymphatics, and it has free reign to go anywhere. So one of the things that they will do is they will take out sentinel nodes and look to see if they can catch, if cancer has made it out past the first couple of sentinel nodes, then they know there's a good chance that cancer has metastasized and left and gone to other parts of the body. So metastasized means you will find breast cancer in the brain. It will be breast tissue that's cancer in the brain or in the lungs or in the spine. And at that point, then you're usually in a real bad way. That's usually when it becomes fatal. So,
is the lymphatic like on the breast the same in the male body?
yeah, men can get breast cancer.
Oh yeah, but like the
And the
complexity-
lymphatics are exactly the same.
complexity is the same.
Yeah, the lymphatics are the same. So, one of the things, so talking about that 15% fluid that the lymphatics picks up, if you've ever seen a woman who's had a mastectomy, meaning a breast removed, and they take out her lymph nodes, have you ever noticed the arm is completely swollen? It is completely swollen, like the top part of the arm measures the same thing as the bottom part of the arm. And that's because that 15% fluid is not able to be drained, and so it stays in the arm. Has anybody ever seen anything like that? I'm gonna show it to you in a picture here in a minute. But that's because that's how important that removing that 15% of fluid is. And so what they will do is they will put a compression band on the arm to squeeze that fluid back up. They've gotten much better at that. Nowadays, they will baffle lymphatics to prevent that kind of lymphedema. That's what it's called, to prevent that. You have lymph chains. You have lymphatics all throughout here. These lymph nodes will become engaged if you have a lower extremity infection or if you have an STD. These lymph chains here are really important and would help us digest dietary fats. That's a crazy thing, right? You would think lymphatics are just really about helping us with our immune system, but lymphatics actually help drain our dietary fats because the molecules are so big. Do you want big fat molecules running around in our red blood cells, where our red blood cells go? You don't. So that's where our lymphatics come into play there. We'll talk more about it. So, drain interstitial fluid, immune response, and transport dietary fats. We'll go ahead and watch this video. Have y'all been watching the videos at home?
Yeah. Okay,
good, then I'll skip it. So, did you see that little behind the back move? Was that cool? I'll do it again for you. You guys. Trying to loosen you all up. Okay.
Just at the evening class.
Huh?
It's an evening class, so like we're beating
I
up for the
know, I'm
day.
trying to help with the energy.
Some come from work.
Yeah, I've been here since 8 in the morning.
Man, morning.
Dunkin' Donuts is right down the road.
Oh, I've had like free coffee.
Oh, okay, all right, never mind. I don't want you to have a heart attack. All right, lymphatic fluid, lymph fluid. The moment the fluid enters into the lymphatics, it becomes lymph. The source of that lymph is the interstitial fluid. So again, 85% of it returns in the venous system, 15% returns in the lymph, and it returns in vessels, in blind vessels, and we're going to look at those vessels here in a second. It returns to wherever there is a vein, there's going to be a lymphatic right next to it, and it's going to return. How does the vein help get? How does the blood get back to the heart with the vein? What are some of the mechanisms?
A
that help
valve.
Movement,
Valves?
like a valve, movement.
that muscle contraction, valves, breathing, all of those things are going to be in play with lymphatics. It's even lower pressure, because it doesn't have the push from the other side. It doesn't have any arterial side pushing it. It's a blind-ended system. It's just coming back to the heart, okay? So there's lymphatic vessels, there's lymphatic organs, lymph nodes, thymus, the spleen. What about these things in our throat? Tonsils, that's lymphatic tissue.
Hate those.
A lot of people have problems with tonsils. We used to take them out without even thinking about it. The only time we take them out now is if they get so large they occlude the airway. So we let kids have enlarged tonsils now, and we just treat it depends on how many infections they get. And you have actually more than, how many tonsils do you think you have? Now you got more. So you have,
Isn't it 4, like 2 down?
you have palatine, you have adenoid, you have lingual. You actually have a ring of tonsils that protect your airway and your stomach. It's like a ring of, it's like bouncers.
So they don't take the keep the adenoids out like they used to?
No, it's less now. They try to treat it. It depends. If you are a kid that obstructs and has obstructive sleep apnea, and you have constant infections, that's when they'll start looking at taking them out, but not nearly as much as they used to. So we start out with lymphatic capillaries. So of course, everything's happening in the capillary beds, right? This whole process right here, the arterial and venial, all of this reabsorption, all this oncotic pressure, all of that stuff, that's happening in the arterial beds. And so that's where our lymphatic capillaries start out too. These are blind-ended guys. There's no arterial side to push. They're down there right with the veins. And so when the pressure outside in the interstitial fluid gets higher than inside the lymphatics, it opens up these gates. The fluid, interstitial fluid comes in, and now it's called lymph. It cannot escape. Once it's in there, it's in there. And you see how these lymphatic capillaries run all through this capillary bed. Once the lymph is in there, it's in there, not going anywhere. Again, it's going to travel up, back up to the heart, and that's where lymph will eventually return. That is part of our venous return. That lymphatic has to eventually get back into our circulation. It can't stay out. It has to go somewhere, right? So it's just basically, it's redirected to be cleansed of any particular infection that may be happening, and once it's cleansed, we can put it back in circulation. So in circulation, it has to go back to the heart. All right? So, but how we get it up to the heart is the same way the veins do, right? So valves, like y'all said, very astutely, the skeletal muscle pump, and breathing, intrathoracic pressure. When you take that big, deep inhale, creates a negative pressure, and it helps pull things up to the heart, including lymph. Blood and lymph will come back up to the heart with just that negative pressure, and it moves lymph superiorly upwards. So the path of circulation of lymph, you have capillaries, which makes sense because that's where our blood, that's where our exchange happens down there. So that's where that 15% is going to be waiting to enter into the lymph. You have vessels, that's carrying it from the capillaries to the lymph nodes. The lymph nodes, we're going to get to a lymph node here in a minute. It's very much a kidney bean shape, and that's where the first real interaction with our immune system is going to be. In the lymph node is where B cells and T cells and macrophages, all the soldiers, that's where the real defense is. It's like a castle. That's where the real defense is going to be, in those lymph nodes. Then we have lymph trunks, lymph ducts, the right lymphatic duct. The right lymphatic duct drains from the right side of the head, the right upper chest, and the right arm. That's all. The thoracic duct drains everything else. And so if I asked you a trick question, where does the right foot drain into in terms of the major lymph duct?
The right thoracic duct.
That would be wrong. It would be the thoracic duct. The right thoracic duct only drains the right side of the head, the right upper chest, and the right arm. The right leg drains in the thoracic duct.
So it's the right thoracic duct and thoracic duct?
Yes, there's two.
I thought it was right lymphatic duct.
Oh, the right lymphatic duct, yes.
Oh, okay.
Did you say thoracic duct? Oh, you said right thoracic
I
duct.
said right thoracic.
Yeah, so it's just thoracic duct.
Could you repeat that? I'm sorry.
Yeah, so sorry. So the thoracic duct drains the right leg. The right lymphatic duct only drains the right side of the head and the right upper extremity and the right part of the chest.
It's like a-
Why it does that, I don't know. It's like we just got, like, let's just do this part and then we'll do everything else over here. The thoracic duct is much bigger. It can handle the load. Everything will drain, you need to know this, into the subclavian veins. It's a low pressure system. This is the lowest pressure that lymph can drain into to enter back into circulation. And then it will enter into the right atrium. And now we've gone from the capillaries up to the lymphatics. Now we're back into circulation. And that lymph is now cleansed of any invaders that is going to cause us harm. If it's not cleansed and it enters back into circulation, what do we have now?
Septic.
Yes, we have sepsis. We have a real problem. We have now that invader has access to every organ in our body, including our brain. That's a bad deal. Yeah.
If I remember correctly, you said the red blood cells is produced in bone marrow and then it goes to lymph.
So we're gonna talk a lot more about that. You really do like the immune system. Hold on, we're getting there. Okay, two main lymphatic ducts. The right lymphatic duct drains from the right side of the head, the right thorax, and the right upper arm. Basically the right quadrant of the body, like I said. It empties into the right subclavian vein, sorry. I don't mean to get stumbling on my words. The right subclavian vein drains the right lymphatic duct. It's a very small portion of lymphatic drains into the right lymphatic duct. The thoracic duct drains everything else, and it will eventually empty into the left subclavian vein. Easy enough, there's really no way to do that except just solid memorization. You just gotta memorize that. And here's a picture of it. Sometimes the picture makes it easier to see. And you can even get tricky and say the left side of the head drains into what? And it's the, thoracic duct. When I say thoracic duct, I keep wanting to think I'm saying something about Jurassic Park. I don't know why, but I feel like a dinosaur should be involved. But all of these will eventually drain into those subclavian veins. If there's high pressure in there, then lymph will have a hard time draining, and which that's a whole other discussion, but that can be a problem. But that's your duct system. This is lymphedema. So this can either be because we've removed lymph nodes, or there's obstruction in the lymph vessels somewhere. So this is what I mean. Like the size of her arm here is almost equal all the way through. So that means her interstitial fluid there's no way to get her interstitial fluid out. And if you stuck your finger in her arm, you would leave a fingerprint that would leave an indentation and it would stay there for a while. That's called pitting edema. This would be uncomfortable. Your skin stretches, it would be uncomfortable. It'd be heavy, arm would be heavy, it would cause neck pain.
Is that something that just never goes away?
Can over time, you do physical therapy to make that better.
Yeah, we do that at our clinic.
You do?
I didn't know if it was like permanent or not.
Not necessarily. So your body will eventually learn to reabsorb that in different ways. And you would wear a sleeve that's tighter here in the extremity and graduated coming up your arm. So that helps push fluid back up into your arm. You're fighting gravity there a little bit. And then you learn exercises. Muscles are your friends. So in a lot of women, especially at the age where, younger women are getting diagnosed with breast cancer, which is unfortunate and a little bit scary. But at the age where most women get diagnosed with breast cancer, they've stopped doing a lot of physical activity that involves weights. Like we tell everybody, get active and they go for walks, which is great. Walking is great, but it's not all there is. You have to continue to like work your muscles. And they lose so much muscle mass that it's hard to move that fluid out. So they actually, what's one of the things they do in PT is they give them band exercises. Use a lot of bands and because they're not gonna put them on weights. They're not gonna be able to do push-ups. They might do they might do stuff on the wall to help them, but they gotta get some muscle mass.
And pulleys, my grandmother had that, and they gave her a pulley to hang over the door with the rope, and she would have to do
Correct.
Yeah.
those
I
reps.
know they do manual therapy, that's all I've seen so far, but I haven't actually, I don't know the direct exercises that they do. for-
Yeah, and that's one of the things too. And also if you've ever had a massage, anybody ever had a massage? Best things ever. If you've ever noticed how a massage therapist works, they always go with the flow of your lymphatics. They're always pushing towards your heart. They never go away from your lymphatics. They actually are working toward your heart. And that's what they're trained in massage school. So, because they don't want you to have a buildup of fluid in your extremities. So they're always, if you've noticed, they're always pushing up toward your heart with your lymphatics. And that's part of their training. They have a lot of training not only in your muscles, but also in your lymphatics. So when they take off a breast, they also take out sometimes a fair amount of lymph nodes. When they take the lymph nodes, you can end up with some lymphedema. They're much more aggressive nowadays and trying not to remove all of them. They will take out a few, and they're able to even look in the OR now to see if there's any kind of precancerous cells or cancerous cells. So, and they're actually really good at baffling. They do this amazing stuff. My sister actually just had breast cancer surgery a few weeks ago. She's gonna be okay. But they do this dye that follows the lymphatics up. It's really, they've gotten much better at this technique, and so women don't have to suffer like this as much anymore.
A? Oh,
Huh?
D?
D.
Did you say D? Yeah, it's all of them. They definitely have valves, they definitely have the muscle pump, and then negative intrathoracic pressure helps to pull fluid back up to the lymphatics. So, this is a really important idea. Lacteals are specialized, so we call them something different. So in your small intestine, we'll learn about this when we get to GI. In your small intestine is where we do a lot of absorption involving anything that we've just eaten. So if you went to your favorite hamburger place, you got a big old juicy fat hamburger with lots of beef fat in it, with cheese with lots of fat in that, and maybe a milkshake with lots of fat in that. Now y'all want to go get like a milkshake or something? We can just
No.
go to the rest of class at like Steak and Shake, whatever. Once you absorb all that fat, it has to get absorbed across your small intestine into this villus here, and this villus has a special lymphatic vessel here called a lacteal. That lacteal is part of your lymphatics that absorbs dietary fat. And once that fluid hits that, now that's called chyle, C-H-Y-L-E, chyle. Not like the guy from South Park. That's chyle. So, that's how we transport dietary fats out of the small intestine. It doesn't go into the blood, which all the other nutrients do. All the other nutrients go into that vein and head off to that portal system to the liver, but the fats don't. That would be a problem. They have to be prepackaged first. They have to get packaged up in some proteins first so they can make that delivery safely. So, they actually go and get stored in this cisterna chyli. Cisterna chyli, that's like Latin for bowl. So a bowl of chyle. a bowl of milk. And Kylie that's what it looks like. It's milky white. That's what that will look like. It's milky and white. So that's what the cistern of Kylie is. It gets stored there for a little bit on its way up. And it will drain into the thoracic duct. So the lymphatic, and we will see this in the lab. You will see that that lacteal. It's a very important thing to understand and remember. It will come up quite frequently in not only my tests but in other tests.
So where do they deposit this fat?
Why what?
Where do they deposit the fat?
It will eventually
They're not
make its
gonna-
way into. It will eventually make its way into the liver, but it has to get processed. It has to get processed first, and the cistern of Kylie will help do that. So it gets absorbed initially through the lacteal, and it eventually will make its way into the liver. Will it become things like cholesterol?
But is it gonna go straight to the liver from the lymphatic system, or is it gonna go to the heart and then deliver with the arterial?
Yeah, because it has to go through the subclavian vein first.
So the fat is gonna be like delivered together with oxygenated blood to the liver.
But not, it gets packaged before it gets into the blood. It's a good question. I'll come back to that. Okay, so this is the lacteal. This is what you'll see in lab. This is what you will see in lab. So this is the lacteal. This is the small. This is the villi of the small intestine. You will see this not only in here. You will see it for the GI tract too. So this is the GI tract. This is the small intestine. Anytime you see something like this, these little finger-like projections like this is how you know we're increasing surface area for absorption. We'll get to that when we get more to the GI tract. Lymph organs. So now we're going to go to more specialized tissues. So reticular connective tissue is really important throughout the whole lymphatic system. Because if you have a lymph node that you have an active battle going on in that lymph node, so the lymph node swells, right? That's one of the ways, that's how you know. If you've got a lymph node that's working, say you got an earache, and that lymph node right behind your ear is enlarged. So that means you've got an infection going on. You don't want what's in that lymph node to break out of that lymph node and get into the whole surrounding area. That'd be bad. So this reticular connective tissue allows for expansion, but not for explosion of the lymph node. Lymph nodes, I have actually never heard of a lymph node getting so swollen that they break open. Never heard that happening. And that's the reason why that reticular connective tissue allows for them. They're very sturdy. Lymph nodes, like I said, they're kidney bean shaped. They have more ways to get into the lymph node than they have exits. So let's think about that for a second. I want y'all to put your thinking caps on. If you have more ways of fluid coming into a room and very few passages out, what do you think is happening? Let's think about this in terms of traffic. You have 8 lanes of traffic that comes down to 2. What is that doing?
Slow down.
Merging.
It's bottlenecking it and increasing what? Pressure. It's right. Ticking everybody off and everybody down, has road rage. Same concept now. You have 4, 5, 6 vessels coming into that lymph node, but only 1 out. What have you done? What are you doing in there? You're
Slowing
increasing
it
the
down.
pressure. You're increasing the pressure. You're making sure that everything that's in there is under high pressure so it gets filtered all through that lymphatics. So we'll talk about that. So you have afferent lymphatic vessels that are bringing fluid into that lymph node, and you have an efferent vessel that's taking fluid out of that lymph node. You are filtering. That's what a lymph node is doing. You are filtering lymph. And in case there's an active invader, you're going to be finding that out in that lymph node. So this is the structure. So these are your afferent vessels here, and this is your efferent. It usually comes out of the hilum. The hilum is always this area here. It's in this indented area of the vessel, of the the organ. So you have a very tough cortex that surrounds the vessel. You have trabeculi. These trabeculi, so we already know that there's a lot of pressure in there. And then you divide up the interior with these separate little rooms that even increases the pressure more. So you're doing a lot of high pressure filtering of that lymph in that area. You have an outer cortex, which I said is this outside here. You have a deep cortex here. So the cortex is the outside, outer cortex, deep cortex, and then you have the inner medulla. So how the fluid runs in this thick capsule here that prevents the lymph node from exploding. You have an afferent lymphatic vessel. You go through the sinus, outer cortex, deep cortex, medulla, and then efferent. And at that point, you should have been exposed to every aspect of the immune system that's like residing in that lymph node.
When you say trabecula, are you referring to like the same muscle that is in,
No.
or is it just the shape of it?
It's these walls. It's these walls that are made here.
With the same name.
Huh?
Why did they use the same name for?
I don't know. You gotta go back and ask those like old people back in the 1600s wearing the funny hats. They were grave robbers. Literally. The first anatomists were grave robbers. Did you know this?
No.
And it's even true of the first physicians over here, the first anatomists here in this country. I think in the halls of in the walls of some of the buildings in Columbia, in the Ivy League schools, there's corpses, because they were grave robbing to learn anatomy. Sometimes they even converted to even murdering people. They would murder homeless people, prostitutes, because they needed a fresh cadaver to learn what they needed to learn. There's some podcasts about it, and there's some interesting books about it. Yeah. Interesting. All for medicine though, right?
Nah. Every
So this is a histology of a lymph node. You will need to know this. I can guarantee you will need to know this. So it looks like a fluffy cloud. Here's the important thing I want you to understand. In this cortex of the lymph node, there is a germinal center. Germinal center sounds a whole lot like a place where something's born, right? Germinal center sounds like where seeds are made, right? The germinal center is where antibodies are made. B cells live in the germinal centers, and that's where antibodies are made. So when you have an active lymph node, that's part of what is going on. Your B cells, your T cells are killing cells, and your B cells are making antibodies. That's why your lymph nodes are engaged. So germinal centers are in these outer little cortex areas. These are all germinal centers. These are all areas where you make antibodies. You need to know that. These areas out here are all areas where B cells reside. B cells turn into plasma cells. Plasma cells will ultimately make antibodies. The cortex is on the outside, medulla is in the middle. You can see it certainly has less tissue. It looks like a big giant cloud. Pink one, a cloud nonetheless. So you have groups of lymph nodes. If you go to the doctor and you're sick, one of the things the doctor will do is feel under your neck, feel under your jawline, feel under your clavicle, get under your axillary. Axillary is definitely one of the areas where you have a group of lymph nodes. In your groin, they don't often feel in your groin. They will ask you, do you have any lumps, bumps anywhere? If you have an ingrown hair, that might create an active lymph node. If you have an STD, that might create an active lymph node. If you have a cut in your extremity, you might have an active lymph node for that. Where you will not be able to palpate a lymph node is in your mediastinum, so those are deep. If you have a pneumonia, those lymph nodes are likely to get active. Your mediastinal lymph nodes, you will not be able to feel. You will feel cervical's in your neck. You can feel axillary under your arm, and you can feel inguinal. You will not be able to feel mediastinal. Could be a question. I don't know.
If you take out with just one like lymph node, like does it affect a lot the whole system?
Say it again.
If you take out, for example, if there is an inflammation in one lymph node and it like shuts down to like prevent from.
You can bypass.
spread.
There's multiple pathways. You can see there's multiple pathways. And it's not just for infection. Sometimes it's inflammation. If you have a lot of inflammation, sometimes just the inflammation itself can cause a lymph node to get activated. Sometimes women, when they have, when they are about to have their menstrual cycle, their breasts will swell due to hormones. That swelling all by itself will cause their lymph nodes to get engaged because it's removing a lot of extra fluid. That in and of itself can cause a lymph node to get activated. May not be fighting any infection, but just the extra fluid can cause a lymph node to feel like it's getting activated. So if you've hurt yourself and your leg's really swollen, sometimes lymph nodes can get engaged for just swelling reasons. Hormones are a beast all the way around. We talk about those at the end. So you'll need to be able to pick these out. We have a lab guy that shows all these lymphatics and where they're at. So you need to be able to name them and name them appropriately: inguinal, axillary, and cervical. Thymus gland. Thymus gland it occurs only in children. You're born with a thymus gland. As you age, it involutes, gets smaller, and disappears. Why that's important is the thymus gland is where T cells, part of your lymphocytes, go to mature. T cells go to your thymus. So as you age, you lose that thymus cells, you lose the ability to mature your T cells. So therefore your immune system gets a little weakened as you age. Makes sense? Why old people, there's a lot of reasons why old people have weakened immune systems. Anybody else have another idea why their immune system get weakened as you age?
Lack of
Because
nutrition.
There you go, strong work. Nutrition gets poor. As people age, they lose teeth, or they lose the ability to cook. Their dexterity gets impacted, so they can't cook as well. So they cook easy things, microwavable things. Those things they're bad. Like cooking real food, real sit-down foods becomes difficult unless someone lives with them and cooks for them, brings them food. Meals on Wheels only happens once a day, maybe a couple times a week. That's how poorly we take care of our old people in this country. We don't really take care of each other enough as is. So, without nutrition, you don't have an immune system, period. Without proteins, you don't work. So, this thymus gland, when you're a kid, this thing's working like a peach. When one of my surgeons goes and does open heart surgery on an infant, that's the first thing they have to move out of the way to be able to do heart surgery because it's lying right on top of the heart. If they're missing the thymus gland, it's called DeGeorge, and these kids are prone for infection because they don't have that thymus protection right off the bat. So the thymus sits anteriorly to the heart. Immature T cells come there to grow up and learn how to be a T cell. It learns how to kill things it's supposed to and not kill what it's not supposed to. What is T cells not supposed to kill?
Your own self.
That's right. And if T cells
Lupus.
kills their own self, what is that called?
Lupus or something.
Lupus is an example of that, an autoimmune disease.
Mhm.
What is another example of an autoimmune disease?
HIV.
Huh?
HIV.
No, HIV is not autoimmune.
Hmm.
HIV is from a virus, right? HIV can cause some autoimmune, but HIV came from a virus.
Psoriasis.
What?
Psoriasis.
Psoriasis is autoimmune, yes.
Alright.
Like,
Huh?
eczema,
Rheumatoid arthritis.
Yes.
like eczema.
Eczema can be, yes. What involves insulin? Diabetes type 1 is an autoimmune disease, yes. So y'all get it. It's when your immune system turns on yourself. We all have on every one of our cells a little name badge that says, I'm me. And your immune system is made to go, I'm not supposed to kill those guys. They have my name, they have our name on it, I can't kill those guys. But if, whatever reason, your immune system goes rogue and goes, screw the rules, I'm gonna go start killing these guys, then we've got a problem. And then we have to immune suppress ourselves to keep us healthy, in quotation marks. Because now we've put ourselves at risk for infections to keep us from getting attacked by our own immune system. So that's why, I mean, the fact is that if we're all in here with a functional immune system, it's an absolute amazing thing. Our immune system, I really want you to respect it by the time we get through talking about it in greater detail. Spleen. Spleen is a very cool organ, doesn't get enough attention. It's not a highlight reel organ because you can live without it, right? People have had full splenectomies. Sometimes spleens get injured because it hangs out. It's not real protected. It is underneath our rib cage, but it is prone to traumas. Our spleen is important in what goes there. What happens in the spleen in terms of red blood cells? We just talked about it. What happens in our spleen that goes when our red blood cells? Where our red blood cells go to?
Oh, is it a hormone?
No.
They go to mature? Is that where they go to mature?
They go to what?
Is that where they go to mature?
No, they go to die there. So how long do red blood cells live?
120.
days.
120 days. So when they go to die, there's two places they go to get recycled. One was the spleen, the other one was where?
Bone.
No. Liver, yes. The liver and the spleen. And so you have mast cells there, they're gonna break them up, and it's also a storage place. We have an excess blood storage. So in an emergency, the spleen contracts and delivers stored red blood cells to the body, but also it's where red blood cells go to die. It's also got, so you have red, a red aspect of the spleen, you have a white aspect of the spleen, and the white is for our immune system. You can see again, we have this hilum. That whole idea of a hilum is going to come through all the way through the semester. It's located in this left upper quadrant. There are diseases that very much like the spleen. We've already talked about one. Which one did we talk about? It affects the blood.
Wait, which was the question?
Lupus.
Lupus does, but I talked about it the other day. It affects the red blood cells in particular.
Oh, sickle cell.
Sickle cell. Sickle cell definitely likes the spleen, causes splenomegaly. Splenomegaly means it gets enlarged. Anybody heard of kissing disease?
No.
Mono, yeah, mono really likes to make the spleen big. If the spleen's enlarged, that means you are at risk of having a splenic rupture. So that's why when people have mono, what do they tell you to do? Rest, don't move, stay inside, stay calm. Because if that spleen gets very big and it ruptures, you're in for a really bad day and a long day at the hospital. So, again, you have white pulp and you have red pulp, not Pulp Fiction. So, two distinct areas. The white pulp, white blood cells, it's for immune function. The red pulp, this is where your red blood cells go to be recycled and to be stored. White blood cells are your macrophages, and they're responsible for your immune function, including cleaning up anything. Sometimes red blood cells will carry bacteria or any kind of thing that's marked for death. And we'll talk about that when we get to the immune system. And they'll get cleaned off here in the spleen. Those macrophages will clean off the blood as it passes through and kill off anything that's been marked for death. It is vulnerable to injury. We used to, back in the day, we used to go, you can live without a spleen. I mean, in the 50s and 60s, you came in with a splenic lac from a car accident, because no one wore seatbelts back then. And if you did, the seatbelt lacerated the spleen itself, because that's how they made the seatbelts. There were a lot of abdominal injuries back in the day from driving. So if your spleen got cut or was bleeding, they didn't wait to see if it stopped. They just went in and cut you open and took the spleen out and said, called it a day. So what they didn't know, though, was that the spleen helps prevent you from getting attacked, prevented you from getting infections by bacteria, certain bacteria. So if you take the spleen out, you now have to be on antibiotics for the rest of your life. And so we have now become much less aggressive in taking the spleen out. We might do a partial splenectomy. Most of the time, if you come in with a splenic laceration, we will wait. We will wait it out. We will replace your blood. We will sit there and we will wait and see if that doesn't heal and stop on its own. Sometimes they will go in there and try to stop the bleed or anything that's causing the bleed. But we try not to take the spleen out, as it really does protect us from bacteria. So we don't want the illnesses. Let's stop it there. We'll stop on this one. But you can die from a spleen. You can die from a spleen hemorrhage. That's one of the places where, if you're in a car accident, or you come in and you're losing blood pressure and you have